know in the last class? Or we know we never stressed upon that. So what was it? Just 3 sentences. Anyone can start with 1 sentence, then second person a second sentence, and third sentence.
Writing, reading, presentation is skills.
Okay, skills. Right, but skills.
Sir, in detail presentation, IMRD. And
Okay.
next, how to read articles.
Read articles, okay. But we all know that other places also they do read articles, right? So, but what I'm asking is, what is the unique thing that you learn? Storytelling. Yes, we did talk about storytelling. What else? You did that. Say it again.
Think first, outline next, and write last.
Fantastic, fantastic. This was one of the key message also. You have to order it rather than doing simultaneously everything, right? Okay, good. Anything else?
IMRD.
IMRD, okay, he mentioned. Okay, good. Anything else? That's it? Okay.
Images are more
80-20 you said.
In what
What's the
sense?
purpose of
Right, so you focus on making the impact of 20%, and so you have to think about a value of the things that why you are doing, basically, right? What else? Anything
images add more value than long paragraph or words.
Correct, correct. So images, that's a quick reading. Anyway, so that means we did learn something unique. It was not a boring session. Okay, so now I think this lecture you will not see it in any modeling course. And I have thought over it a lot to prepare something on these ends. And this is trivial but very effective piece that we will talk about today. Okay, and it is model thinking. How do we think about modeling? Okay, before I go, how do you structure your day? Now, who was listening to me when I was talking carefully, when I was talking in the morning, in the first thing in the day, in the afternoon? What is one word I used? Let's see if someone remembers that. You know, I just talked like for a few minutes, right? When I was during the inauguration, right? What is one word, key word I use? It's very important you have to chew the words that a person is speaking. This is very important. Say it again.
Valuable.
Okay, value is vendor. Right. We don't hear that. Value is a really very important word. Good point. What else?
Communication.
Communication. Very good point. 2 words. But this is not the word I am thinking of. Okay. Well, value and communication gives you a structure also, right? I use a word holistic. Holistic. And what that holistic means is when you do the model, you are a good modeler, not just by knowing the mathematical equations, right? And doing the analysis. That doesn't make you the good modeler. The good modeler is someone who knows how to communicate, someone who knows how to plan yourself, someone who knows how to write effectively. These soft skills. These soft skills makes a person a holistic modeler. Holistic word, have you heard of holistic? HOLIS, right? Holistic. So it's a very important. So I am making a comprehensive modeler, not only by analysis, not only by simulation, not only by writing a ground equation. That is not my task only. Okay, and this is very key aspect. So how do you structure your day? How you structure your day is, how many of you do that? Can I see a raise of hands? How many of you every day structure your day? What does that mean? Plan your day. You do it, okay? And how do you do that? No, you can see, sit and talk. Yeah, yeah. How do you structure it? I mean,
or some task and
so you write it down.
no, sir.
Okay. So
I
again,
write it down.
you write it down?
Yeah.
Okay. So writing down makes you clearly, and you will not brand do. Again, that's a good thing that you are doing that one. But then next step is to write it down also. This is very key. And this is, we get lazy. And we are not saying you guys, but I also get lazy. Okay. And we need to be structured it very. So let's see the structure means. 1 minute planning saves 10 minutes of execution. And that's a known fact. That's an experiment done by the social scientists to find out 1 minute of planning saves you. You know, many times we do mental exercise of modeling. Oh, that assumptions is good, this is that, and then 2 seconds later I forget about what I thought about it. Right? Or when we search for something in a Google and not write it down, we research it again a few minutes later. It happens to every one of us. So that 1 minute of planning we are not doing. Okay, so this is very key aspects to the modeling exercise also. Again, I want a person to be effective. Now I also teach mental health in my modeling class. So holistic doesn't mean only structuring the day. I do talk about sleep. I do talk about exercise. These issues are also part of the modeling exercise. In my classroom, I give a graduate level and undergraduate level modeling course, and I do bring. Sometimes I bring the mental health specialist in my class, and sometimes I know some things that I can discuss about, and that is coming from a published work. It's not that I am making up the story, by the way. Okay, so it is always said when I work in industry, it is trained. And I'm working with some of the good companies in US. I'm trained in last 10-15 minutes of the day at 4:30 p.m. They ask us to write it down what you will do it in the next day. Usually 4:30 the office closes. But they don't let you go and they let you choose that time to write down what you will do next day. If it is a working day next day. Otherwise a Monday. If it is Friday, because it's a 5 days a week work, right? So that is very important. That saves almost half a day. That planning saves half a day of wastage of time if you don't do it. You will see the huge difference actually. Okay. And that is what I mean by order priority. Now here also come 80-20%. We do. Again, this I don't want to go there. This will kind of fill up the whole things, but this is very scheduling and planning ourselves for the next day is very key aspects for the modeling. I want to go in the next slide. I think there's a lot of things. I want you guys to see these videos. It's called Millionaire Schedule. How the millionaires schedule their activities, and that's why they're millionaire. You know what is millionaire? People very rich. Why do we? Now it's not about money. I'm not talking about money here. I'm talking about what makes things successful in the life. The success is meaning different for different people. It doesn't mean always money. Success could be, I finished the good modeling paper published in Lancet, for example. Right? So that is what I mean by, if you look into these videos, if I'll play it, it will take minutes, but it's a cartoon video. It's a cartoon, but it's an eye-opener for you. You will be amazed to see, I never thought, these things happen every day, and I never think about these things. Okay, so I will share these slides, so you will have it by tonight. So you can feel free to go over them at your own pace. Okay. And it's not about rich. Don't take it in the other way. I don't want, of course, if you will become rich, share with me the money, that's okay. But that's not the main goal I am trying to focus on. What are jobs looking for today? These things. And do we know these things? We think that we know it, but truly do we know it? Okay. So for example, algebra. Most of us are mathematicians. She's an anthropologist, so she would now. So we have certain strengths, certain other strengths we need to fill. In today's world, you all need all these things. You cannot say, I'm good in mathematics and I don't want to run programming. or I don't want to do communication, right? And I'm good in maths, so I will be successful. No, you will not be. You have to have all of them tick marked at a very high level. And this is not algebra, for you it is casual if you are in mathematics major, algebra is casual. But if you ask some biologists, algebra course was very tough for them. College algebra I'm talking about, not abstract algebra. If you know what I mean by difference in the two. Right? So, what I'm trying to say is, these are basic critical threshold that you need to know in today's job markets. Now when I say program, the AI comes in that. It's a common language nowadays. But you should not do it blindly also. People are using AI blindly. Again, we have Dr. Anamika will be talking about some of these AI tools that are good, but again, how you use it and in some class in the later on. But these are very, get involved. Remember this research skills that I was talking about? Get involved in this research. So these are all five, actually these are 5 skills. It's published in Forbes magazine. And this is, these editors of these good New York Times, Washington Post, Forbes, they do a lot of research to write down the articles, simple articles. They do lots of research. So they go to the social scientists, they go to take a surveys, and from that they write it down these. So they have statistics, they have citations in their. So I just put these things as a list here for you to see. Now I want to talk about the modeling evolution, the method evolution. Can you guys see it from the back? I don't know if it is very bright or. Is that possible to close this light actually? Is it better? Yeah? Okay. So, एक कप इतना कप
ये मत करो
अगर दिख रहा है तो सही it's okay. So what it is showing is a time evolution. This is 1930 to 2010, and this is the time when things starts to pop. What field starts to become popular, and how long it took to become to its really mature state. Right? For example, probability theory and stochastic process started around 1930s, and they evolved during this period of time till 2000. They evolved a lot, but after that it is kind of almost negligible in some sense. I mean, again, there are studies happening, but not as much as it was happening during that period. And then dynamical systems started around 1940, a lot. During this time, it is quite a lot. It is work. And then operation research is more young field, more young. It started around 85, I think. Yeah, 85. Right. So it is going from 1930 to 2010. By the way. Okay. So there's combinatorics, graphs, operation research, graph theory. Now, history tells you many things. I get very fascinated with how people have studied certain things, and even in the disease modeling, and I will show you the history, how things have evolved a period of time. That helps me think about what are key aspects people were looking at different times when the tools were less mature, for example, how they were thinking. So these are the things very key. My area has been stochastic process and dynamical system, those two areas. My dissertation was on stochastic process, and I use a lot of infectious disease dynamical systems, by the way. So I have edited books in stochastic processes, and I worked with my PhD advisors. I had 2 PhD advisors. One was a well-known expert in infectious disease, and the other one was considered as queen of probability. So they are very old now, they are in 80s. But I was lucky to be exposed to 2 different topics. Okay, and statistical mechanics is also relevant. If you see the title of this course, it is many things. It has global health, it has statistics, it has mathematics, it has computational science. It's an intersection of something in the middle, right? And so we don't understand other side of the world very well. We have to know those things. Okay. This has becomes key research area, differential equations and in the modeling. Of course, there are different models, but these are more popular in the modeling nowadays. Current methods are using these complex networks. You know complex networks? Okay, we have a lectures also, in one of the lectures on complex networks. You will see it for the disease models, basically. And then, what else is there? Combinatorics also we are using some of it. Dynamical system, of course. Now, this is since 20th century. This is 20th century, the whole century we are talking about. 1900 to almost 2000, 2010, right? Here we are talking about after that, how things have, in the last part of because lots of research has been done. So how things have evolved. So complexity science, the word complexity science started to pop up in 1980s. It is used also in mathematics, also used. It is also used in physics. It is also used in computer science. Right? So complex systems people use. Agent-based model. Have you heard of agent-based models? Anyone? Very important topic. In the agent-based models, there's two types of models: micro-simulation models and agent-based models. Micro-simulation models also have individual modeling. Agent-based model also have individual modeling. In micro-simulation modeling, there is no interaction between the two people. In agent-based, there is an interaction between the people. That's the difference. There are two types of models. If you model things, suppose if I model how all of us are behaving here, or maybe something is spreading, ideas are spreading in this population, then this is an agent. Each and every individual is an entity in my model. Okay, so that's an agent-based model. Because you will interact with each other, therefore it will be called agent-based model and not micro-simulation. If each individual do their own things and not interact, then it is called, for example, people going in the hospital, standing in the line and going in the hospital. Everyone go and do their job. They don't interact with each other, right? So that's a micro-simulation model. Does that make sense? Remember that, individual. Population, there are two types of model. Population levels and then there is an individual level, right? So I'm not talking about population level where you aggregate people and you talk about population. Here it is individual I'm talking about. So there are two types of model, micro-simulation and agent-based. Agent-based has interaction and micro-simulation does not have interaction. By the way, last class we will talk about agent-based also. Multi-agents, now we are talking about multi-agents. Have you heard of the word agentic recently?
Yes, agentic AI.
Okay, what is that? Anyone else has heard? No. Agentic AI you have not heard?
It is like make.com and doing the automated task like sending emails, WhatsApp to
Correct.
users.
ML, machine learning.
Right. Machine learning is a method of learning, right? But agentic AI is multiple agents doing task and bringing it together to do a bigger task. For example, if I want to buy an air ticket from here to maybe Dehradun to Delhi, right? So that task will be going to the website, searching the website is one agent, getting the different airlines is one agent, getting the cost of the airlines is another agent, right? And then finding the shortest minimized cost is the fourth agent. So there are different agents finally coming together to tell me what is the best price to buy or giving me the best ticket to buy from Dehradun to Delhi. So it is called as an agentic AI. multiple agents coming together to doing a very complex task. Getting an air ticket is a complex task by a machine, not by us, but by machine it is. Also for us it will take many hours, by the way. So it is called multiple agents. And we do in mathematics this thing. I built a model where, and I will show you the website tomorrow actually, I am not prepared to show right now, but I will show it tomorrow. So I will show how people are interacting in that movie, and you can see that it's a think about it as a space satellite watching a city, and people are going everyday business, different people, and they are infecting each other of an outbreak. So we mapped a Portland city. Portland is a city in the US, and we mapped it using each agents basically. And we came to know what are the places where people are more likely to get infected. We were talking about flu at that time. It is 10 years old study, by the way. So flu, for example, people will get infected in office more, in a grocery store more, in a school more. That is what our intention was from that model. Okay, so that is called as a multi-agent model, by the way. Now these things are newer field, but they are primer. The base of these things are evolved from the complex system dynamics, optimization, probability game theory, and event-based simulation, cellular automata. These are different types of models, right? Now again, it's not possible for us to do it in this 1 week course, everything, but I want you to be aware of that there are these type of modeling also, and it has evolved in what period of time. Artificial intelligence is nothing new. Nothing new. It was in 70s, by the way. It was in 60s, by the way. Artificial intelligence. But it was very naive at that time. Right? Like Apple, like what else? Microsoft. These all have big AI models starting 2005, 6, 7, something like 2005, 2006, 7. And their things failed miserably because they were not really collaborating with practical scientists. So I'll show you the example in the next class, but you know, there are ways, so artificial intelligence is nothing new, even though we are hearing nowadays a lot, but it is nothing new. It's has a past history. I mean, if we are scientists, we should be knowing all these things. Neural networks. How many of you know neural networks? Why one should know neural network? Now, this is a common knowledge nowadays. If you want to get a job in today's job market, you should know what a neural network is. It's not complicated to know, to not know. What is neural network? Is models behind artificial intelligence. Behind artificial intelligence, the models that they use are called neural networks. Say it again?
Multi-layer perceptron.
Right, so there could be many complex ones also, but the basic idea is called neural network. Okay, which is very important. I can show a diagram quickly since I can see some of you have not seen that. In the next class, I will try to collect some information and show one picture, and you will get a feel of what neural network is. Genetic algorithm. You have done it, right?
Wow. Yes.
So, because he's worked in genetics actually. So, yeah, so it is, I mean, genetic algorithms are algorithms that are, because genes are transformed from many generations, right? I mean, I have my father's gene, father has my grandfather's gene, and so on and so forth, and my mother's side also, right? So they are getting evolved over a period of time with some features coming from my ancestry and some from my environmental conditions that are getting changed. So genetic algorithm is based on certain features like these ones, and it evolves very fast, and it takes into account multiple layers of features. Okay, evolutionary models. Why were we not able to capture the COVID? Remember COVID?
Yes.
What was the problem with the COVID? Why were there so many casualties of COVID?
Strain was mutating, mutation.
Yeah, you are not supposed to give the final
The
answer.
phospholipid layer of the protein was not.
No, not that sophisticated. Yeah, well, that I got it. But my point to you is, we are so smart. Human beings are so smart. But why were we not able to capture?
Because it evolved very rapidly.
Correct. I think he and you said the same thing. Yeah. So exactly, because the viruses were evolving faster than prediction of what?
Previous
Prediction of models.
model.
There, we were doing the modeling. That's what I'm trying to say. It's not that we don't have any idea, all of a sudden we forget about the model. Models have history of 100 years. We had the idea of models, we were modeling it and we were doing it a good job, but as soon as we build a model, the strain changes, the infectivity changes. And therefore the model was not anymore good it was good for the old strain, but not good for the new strain. That was the big problem. And all the policy government of India was making, US government was making, was based on models. Every decision they were doing on a daily basis, how many beds we should keep, which population, which intervention I should implement in the population, which population I should restrict from taking vaccine, which population I give most vaccine. These are all decisions on a daily basis were taken by a modeler. There's a very famous professor. I think I would like to have him also in one of the lectures. I will try to see if he can join the panel discussion. He's my very good friend. His name is Gautam Menon. He works for Ashoka University. Exactly.
I know
He's-
him.
You know him also, right? So he's very well known. He writes articles for Times of India, Hindustan Times, and all these things. But he's a physicist by training. He's a professor at Ashoka University. But he was modeling for COVID, and his model was called Bharat Sim. And that policy was decided based on his models at that time, right? So I will try to see if I could have him for a panel discussion. I don't know, but we'll try. So these are the evolution of the models. We use, I have used in some or other studies one or combination of these models that you are seeing. Okay. Tipping point. How many of you know what is tipping point means? What is tipping means?
Like in the restaurant, we give tips sometimes.
Okay, that's a different one. So, what is tipping point? Tips. If you have a glass full of water and you slowly you try to push, there will be a point when it falls by itself. That's a tipping point. You understand? Tipping point is when state drastically changes to some other state in mathematical terms. Okay, why I'm talking about that? Because everyday policymakers wants to know the tipping point of a system, of a policies, of a health system, of a hospital settings. Everywhere, what they are aiming to answer the question is about when something breaks or when something they cannot handle it. They want to know that so that they can plan, they can budget it. You understand my point? So, there's a very famous book by Malcolm Gladwell in 2001. It's called Tipping Point. How many of you have done mathematical epidemiology before? Disease models? Disease models, right? How many of you know about tipping point then? I mean, at least those people I'm asking. You know what is tipping point?
In dynamical system,
What is it?
when we can say bifurcating point.
Bifurcation, exactly, bifurcation point. But what I was asking was in mathematical epidemiology.
Reproduction number.
Say it again?
Reproduction number.
Reproduction number. Reproduction number. Why is it called tipping point then? I don't understand.
It's an average number of
No, but why tipping point? Why it is called tipping?
Because
the threshold. After that, it will become epidemic.
Correct.
It's below 1 means
So
endemic.
the state changes.
State.
No infection to big infection. So that point is called reproduction number equal to 1, right?
One.
So that's why we call it, that's a part of an example of tipping point. I have a chapter which only talks about variety of tipping point. Vectorial capacity, I don't know if you guys have known about it. When there is a, how many of you know malaria, right? You know dengue. How is it spread? Mosquitoes.
So,
There is a tipping point in infection through the mosquito also. They bite many times, but there has to cross that limit in order for it to become an outbreak. We calculate it using mathematical models. Okay, so there is it is called vectorial capacity, just like reproduction number in epidemic, vectorial capacity in vector-borne diseases.
Ali effect.
Ali effect, yeah. So there is a threshold, right? It's a bifurcation basically. It's a bifurcation that is happening. Ali effect is happening on one side, on the other side there is nothing, right? So that's what is, that point is a tipping point. Absolutely correct. In ecology. Excellent. Yeah. So in real life, okay, let me, do you have any examples in real life that you have seen tipping point? It's a very important concept because, as I'm saying, all models is talking about risk. They may not call it as a tipping point, but it's exactly for example, in vaccine, we are trying to find when will the vaccine going to eliminate the disease. It's a tipping point of the vaccination. You understand? It's a different terminology we are using, but the behind the scene, the essence is tipping point. What other things? Can you give an example of your real life?
When we go to the bed before sleeping, the point at which our mind gets
Okay.
here.
Well, that's okay. That's good. Yeah.
Minimum passing marks.
Huh?
Minimum passing marks.
How is that so? Explain me.
In exam, 40 marks.
Oh, it's a great. So I see. So if the 40 marks is a threshold you have kept, right? But that is a fixed thing, right? That's not, see, in the reproduction number or vectorial capacity, or these things are decided by environmental variables. It's not a fixed thing. Well, what you are saying is always fixed. Whatever the instructor fix it. It will not change by natural phenomena that is occurring based on number of students, or whether students are weak, whether students are turning their sign. It will not change. It will remain the fixed. But that's not a natural tipping point. It's like a artificial tipping point. So I'm talking about natural tipping point. Any one very important example, we see it in everyday's life. Have you gone on the street and you go and there is a fight happens with anyone? Sometimes it becomes very big, and sometimes it doesn't happen. I mean, people just walk away. Right? It's a tipping point also. Now we don't understand why sometimes it becomes a big things. I mean, you driving and then something happens, scratch happens, and then people start shouting, and the other times, okay, bye-bye, nobody cares. There are many social factors that makes it things to tip, basically.
So we'll close within 5 minutes,
Okay, fine.
then we'll continue tomorrow onwards.
Okay, fine. Fine. So this is tipping point is very important. By the way, I was talking about roids. Remember roids? There was Gen Z roids in Nepal. Have you heard about that?
Yes.
Something happens in Bangladesh also, right? Why did this happen and not happen? Equal intensity there happened in other places, but never become these big issues. But sometimes it does become. That's a natural tipping points. We do it mathematically, these things. In ecology we do it, just like Ali effect he was talking about. In epidemiology, just like reproduction number. In social science also we do it. As I was talking about roids, right? You name the system and there are tipping points. And the goal of a modeler is to calculate formula for this tipping point. And that is the model thinking. Okay, very quickly, model for biologists is RAT. The terms, the language is very different. You don't understand these things that when you talk to a biologist, you'd say model. You will not say equation. As mathematician will think equation. The biologist will think rat. The social scientist will think about flow chart. For model, the flow chart is for engineer, it is a toy. Caricature of a big thing. It's a model. So you see the same word, different terminology in different language, different fields. Make sense? So that's why we have to work with the other side of the word. I want to work with him because I want to work with anthropologists because I don't understand that language. And even though they will use the same word, but it might have a different definitions in their language. Okay, and that we will get to know only when we work together. Okay, so anyway, I have a lot of things, but there is some books that is very important. How science works, collapse. These gives a different perspective of what model is about. Okay, I think since I will stop here, I will not go any further. These are some of the courses that I would highly recommend. But one thing, as I said in the afternoon, that beginning of the again, I will share this slide, so don't worry about it. I will share this slide. You can get a good idea if you can understand. I think I've done an okay job in explaining it, and you might be able to read it and understand it. But if not, you can always ask me. Since we have 5 minutes, I can use 5 minutes?
Yes, sir. Yes.
5 minutes. Okay, so tomorrow's task for all of you is as follows. We have to do research projects. Okay, so tomorrow, first thing in the day, we will be circulating a sheet of paper, and I want the names of one group. Again, we are not assigning you in a certain group. You choose your own group. Try not to be in the same institution as you are in. Try. It is good for you. Choose someone new, someone that you don't know as a group. I'm looking for 6, 7, 8 people in a group. Again, number could be plus minus few numbers, it is okay. But at least 6 people. At least 6 people in a group. And form your group and think about some problem of interest. I will start with some examples of an applied field that will help you again, once you choose a topic, you will discuss with us and we will going to help you reframe the research objective for that research question. It could come from a social scientist, social science, it could come from anthropology, it could come from genetics, it could come from biomedical fields, it could come from any random field, I don't care. But it has to be a novel, interesting question that you all agree to work on. How you will do the questions, research on it, that's a secondary, don't worry about that. It should be. All of you have done any research? Has anyone never done the research? Never? Okay. Never? Okay, that's fine. We will all help each other. Okay? We will help each other, right? So we learn we are not born with all these skills. We learn from them. Is the point clear? So what is the task tomorrow? That we talk to each other, right? And we choose our group. 6, 7 people at least, right? Per group. And we are forming, again, research question is, I don't expect everything to be done by tomorrow. It will be phrased better as we go in the next class. And I will show you some examples. After seeing my examples, you will see, oh, I can work on this also. Oh, I can work on this also. Not only on infectious disease, not only on oncology, not only on, I worked on, as I was saying, roids, for example. I worked on why Gen Z outbreak happened in Nepal. That could be an interesting problem. What I will help you with is revising your research question in a credible way, which is publishable work, plus then we have to think about the equations for that. Is that clear or partly clear? If partly clear, I think we have achieved the goal. Yep. So that way force us to even talk to others. Okay. Okay. So thank you very much and.